One of the ways that the health screenings have changed is just by we started off at the clinic where we'd be inside and we'd be able to give, proper blood glucose and blood pressure testing to patients after they would come from the food pantry and collect food, and it was a very easy environment to work in. And now things have changed where we have a drive-up clinic. Cars are coming through 2 lanes, and that makes it tough because they're getting food, they're getting instructed by a lot of people, and they're confused. They don't know where to go. They don't know what to do. They don't even know that we're necessarily there to help them. Their biggest concern is, in a patient population that needs to choose between food and medicine, their biggest objective is, I'm there to get food for my family, and that sort of thing. I would say the way that we interact with patients now is a little bit different than the way that we did before. Before, we were able to have close contact with them, really get to know them as people, talk to them, and now everything is more rushed. Clinic times have changed. From 4 to 5:30 instead of 5:30 to 7:30. So that being said, they want to go home, make dinner for their families, and that sort of thing. So with all the social distancing protocols in place, it makes it difficult because we've had to establish, having a patient put their arm out of a window to test their blood pressure. Is at least we can get it heart elevated, at the heart level, to test their blood pressure, and then the glucose as well. Definitely patient communication with the students and the pharmacy staff and other healthcare staff has definitely decreased during this process.
I just want people to know that just because there's a pandemic going on, and yeah, we do need to social distance and wear masks and all of that, you don't just have to go to the doctor because you think you have COVID. Other health conditions, it's still important to manage, and people are scared to go out to the doctor's office right now just to get their blood pressure checked, but it's still just as important as it was before the pandemic. So we just want people to know that we're here and we're trying to make it easy and accessible to get those things checked, and also try to put things in place to make people comfortable while they're there. We just try to make them as comfortable as possible, but I just want people to know that just because there's a pandemic going on doesn't mean there are other health conditions that happened prior. They're not less important than the pandemic and COVID going on right now.
So as far as patients are concerned, during this previous clinic, I was in charge of going around to each of the cars and handing out the flyers, kind of explaining what we're there for, what we're doing, and I was able to connect with a few of the patients and kind of ask them how their family was doing. And this was even before they even knew what I was even talking about. Just kind of getting to know them, and especially with these trying times, I think that there needs to be a bigger focus on not just the physical health of the patient, but also the mental health. And so that's why I tried to incorporate a few questions here and there, just to tell them that, hey, I'm not just something, I'm not just a robot that's just here to, hey, this is your blood pressure, hey, this is your blood sugar levels, and then send them on their way. Just show them that if I can show them that I am empathetic for them and I'm sympathetic, that they'll come back and they're more likely to continue to stay on whatever health plan that they're on. And then for the staff, all of us are wearing our protective PPE, and we're just taking every precaution that we can. We have hand sanitizer available. We change gloves between each of the patients, and we maintain that 6 feet. There's a car window. We try to maintain as much as we can. Obviously, when we're doing blood pressure, blood glucose, we have to get a little bit closer, but we try to maintain that distance. And we're just doing something better for the community. And I think that's also plays in the mental aspect. Because if you feel good about it, you're doing good. You'll always feel good.